AMCA practice test answers, 112 questions with explained answers. Question 1. Faithfulness, or allegiance to a cause, ideal, custom, institution or product, is called Option A. Loyalty. Option B. Dependability. Option C. Courtesy. Option D. Flexibility. The correct answer is Option A. Loyalty. Explanation. Loyalty means faithfulness or allegiance to a person, organization, cause, or principle. Question 2. The information of blood cells is defined as Option A. Hematopoiesis. Option B. Erythropoietin. Option C. Mean corpuscular volume. Option D. Hemoglobinopathy. The correct answer is Option A. Hematopoiesis. Explanation. Hematopoiesis is the process by which blood cells are formed and developed, mainly in the bone marrow after birth. Question 3. Which of the following is correct for ending a venipuncture procedure? Option A. Remove the tourniquet, remove the needle, remove the tube, apply pressure. Option B. Remove the tourniquet, remove the tube, remove the needle, apply pressure. Option C. Remove the needle, remove the tube, remove the tourniquet, apply pressure. Option D. Remove the tube, remove the tourniquet, remove the needle, apply pressure. The correct answer is Option B. Remove the tourniquet, remove the tube, remove the needle, apply pressure. Explanation. Releasing the tourniquet and removing the collection tube before withdrawing the needle reduces venous pressure and helps end the draw safely before pressure is applied. Question 4. The hormone tested for in pregnancy tests is Option A. Thyroid stimulating hormone. Option B. Progesterone. Option C. Estrogen. Option D. Human chorionic gonadotropin. The correct answer is Option D. Human chorionic gonadotropin. Explanation. Pregnancy tests detect human chorionic gonadotropin, a hormone produced after implantation and released in increasing amounts early in pregnancy. Question 5. The term used to describe sophisticated and highly complex care is Option A. Managed care. Option B. Tertiary care. Option C. Secondary care. Option D. Primary care. The correct answer is Option B. Tertiary care. Explanation. Tertiary care is highly specialized, complex care that often involves advanced technology and subspecialty expertise. Question 6. One method to calculate heart rate from an electrocardiogram strip is to Option A. Count the small boxes between the R to R interval and divide by 1,500. Option B. Count the number of small boxes in the R to R intervals and divide by 2. Option C. Estimate by counting R peaks in 10-second strip and multiply by 10. Option D. Count the number of QRS complexes in a 3-strip and multiply by 10. The correct answer is Option A. Count the small boxes between the R to R interval and divide by 1,500. Explanation. At a paper speed of 25 mm per second, dividing 1,500 by the number of small boxes between consecutive R waves estimates the heart rate for a regular rhythm. Question 7. A patient came to the clinic for a low-grade fever of 1-month duration. As part of the laboratory workup, the physician ordered erythrocyte sedimentation rate. What color tube would be used for this test? Option A. Green top tube. Option B. Light blue top tube. Option C. Lavender top tube. Option D. Red top tube. The correct answer is Option C. Lavender top tube. Explanation. The source keys a lavender top tube for erythrocyte sedimentation rate testing. Collection requirements can vary by laboratory method, so the laboratory protocol should be followed. Question 8. Sinus is a slow dysrhythmia. Option A. Bradycardia. Option B. Tachycardia. Option C. Rhythm. Option D. Dysrhythmia. The correct answer is Option A. Bradycardia. Explanation. Sinus bradycardia is a sinus rhythm with a slower than expected rate because the sinoatrial node is firing slowly. Question 9. Which of the following vacutainer tubes is routinely used for hematology testing? Option A. Light blue top tubes. Option B. Red top tubes. Option C. Lavender top tubes. Option D. Green top tubes. The correct answer is Option C. Lavender top tubes. Explanation. Lavender top tubes contain ethylenediamine tetrashic acid, which preserves blood cell morphology and is widely used for hematology tests such as a complete blood count. Question 10. A 45-year-old man comes in for a stress test. His resting blood pressure is 120/80. During the stress test, his blood pressure dropped to 95/55 and his skin is cold and clammy. What is the best course of action? Option A. Stop for a minute, then resume. Option B. Stop the test immediately. Option C. Slow the test and then pick the pace back up. Option D. Push forward with the test. The correct answer is option B, stop the test immediately. Explanation. A major blood pressure drop with cold, clammy skin during a stress test suggests poor tolerance and possible circulatory compromise, so the test should be stopped immediately for patient safety. Question 11. Defamation through spoken statements is known as option A, libel, option B, sympathy, option C, empathy, option D, slander. The correct answer is option D, slander. Explanation. Slander is defamation communicated through spoken words, while libel generally refers to defamation in written or recorded form. Question 12. The National Health Insurance Plan for Americans age 65 and older is option A, Civilian Health and Medical Program of the Department of Veterans Affairs, option B, Medicaid, option C, TRICARE, option D, Medicare. The correct answer is option D, Medicare. Explanation. Medicare is the federal health insurance program that primarily covers people age 65 and older and also covers certain younger people who meet eligibility criteria. Question 13. The body organ targeted by hepatitis B virus is the option A, brain, option B, liver, option C, heart, option D, lungs. The correct answer is option B, liver. Explanation. Hepatitis B virus primarily infects liver cells, so the liver is the main organ affected by the disease. Question 14. How far above the site of draw is the tourniquet placed? Option A, 3-4 inches. Option B, 1-2 inches. Option C, 5-7 inches. Option D, 4-6 inches. The correct answer is option A, 3-4 inches. Explanation. Placing the tourniquet about 3 to 4 inches above the intended puncture site helps make the vein more prominent without obstructing access to the site. Question 15. Which of the following procedures is appropriate for preparing blood and other potentially infectious materials for transport? Option A, freezing the materials before transport. Option B, placing the materials in a leak-proof container during collection. Option C, decontaminating the hazardous waste container. Option D, relabelling containers provided for waste. The correct answer is option B, placing the materials in a leak-proof container during collection. Explanation. Potentially infectious specimens must be placed in leak-resistant containers so blood or body fluid cannot escape during handling and transport. Question 16. This unit in the hospital is run by physicians and experts in the field of musculoskeletal disorders of bones, joints, ligaments and tendons. Identify this department. Option A, rheumatology. Option B, obstetrics. Option C, ophthalmology. Option D, oncology. The correct answer is option A, rheumatology. Explanation. Rheumatology focuses on disorders involving joints and connective tissues, including many conditions that affect bones, ligaments, tendons, and surrounding structures. Question 17. The Q wave, if present, is always option A, positive, option B, present, option C, isoelectric, option D, negative. The correct answer is option D, negative. Explanation. A normal Q wave, when present, is the first negative deflection of the Q or S complex before the first positive R wave. Question 18. The patient's chart indicates a urine sample was collected at 1800. This means the sample was collected at option A, 8 inches the morning, option B, 8 inches the evening, option C, 6 inches the morning, option D, 6 inches the evening. The correct answer is option D, 6 inches the evening. Explanation. Military time 1800 corresponds to 6 inches the evening because times after noon are converted by subtracting 12 from the hour number. Question 19. What is the appropriate test used for heparin therapy? Option A, point-of-care testing. Option B, activated partial thromboplastin time. Option C, hemoglobin and hematocrit. Option D, serum separator tube. The correct answer is option B, activated partial thromboplastin time. Explanation. Activated partial thromboplastin time is commonly used to evaluate the effect of unfractionated heparin on the blood clotting process. Question 20. Which limb sensor is the reference or ground electrode? Option A, right arm. Option B, left arm. Option C, left leg. Option D, right leg. The correct answer is option D, right leg. Explanation. The right leg sensor serves as the reference or ground electrode in the standard electrocardiogram limb electrode arrangement. Question 21. Which of the following requires all employees workplace hazard training? Option A, standard precautions. Option B, blood-borne pathogen. Option C, emergency action plans. Option D, hazard communication standard. The correct answer is option D, Hazard Communication Standard. Explanation. The Hazard Communication Standard requires employers to provide information and training about hazardous chemicals that employees may encounter in the workplace. Question 22. What does this symbol represent? Option A, chemical hazard. Option B, biologic hazard. Option C, radioactive hazard. Option D, Sharp's hazard. The correct answer is now shown. Explanation. The source does not include the referenced image or a keyed answer for this item, so the correct response cannot be supported from the supplied material alone. Question 23. What is the function of the large intestine, also known as colon? Option A, absorb water. Option B, absorb sugar. Option C, absorb fat. Option D, absorb vitamins. The correct answer is option A, absorb water. Explanation. The large intestine absorbs water and electrolytes from intestinal contents and helps form and store feces. Question 24. Tachycardia is a pathology that damages mainly the option A, heart muscle. Option B, brain. Option C, blood vessels. Option D, body organs. The correct answer is option A, heart muscle. Explanation. The source keys heart muscle. Tachycardia means an abnormally fast heart rate and can increase cardiac workload, but the wording that it directly damages one organ should be reviewed for accuracy. Question 25. When a patient fails to show for their appointment, the event must be option A, erased from the schedule. Option B, written on a no-show log. Option C, monetarily charged to the patient. Option D, documented in the patient's chart. The correct answer is option D, documented in the patient's chart. Explanation. Documenting a missed appointment creates a clear record that the patient did not attend and supports follow-up, continuity, and risk management. Question 26. The tube of choice for glucose testing is option A, gray top tube. Option B, red top tube. Option C, light blue top blue. Option D, lavender top tube. The correct answer is option A, gray top tube. Explanation. Gray top tubes contain additives that slow glycolysis, helping preserve glucose concentration in the specimen before laboratory analysis. Question 27. What organ's main function is to eliminate excess water and waste products from the body? Option A, liver. Option B, intestines. Option C, gallbladder. Option D, kidneys. The correct answer is option D, kidneys. Explanation. The kidneys filter the blood, remove metabolic waste, regulate water and electrolytes, and excrete excess substances in urine. Question 28. A female patient came into the clinic for follow-up after a right-sided mastectomy with some removal of lymphoid tissue. What is the name of the condition that makes blood draw on the right arm not recommended? Option A, syncope. Option B, lymphostasis. Option C, anemia. Option D, hemoconcentration. The correct answer is option B, lymphostasis. Explanation. Lymphostasis means impaired lymph drainage and can occur after lymph node removal, which is why venipuncture is often avoided on the affected side when possible. Question 29. The mental and emotional condition, enthusiasm, loyalty, or confidence of an individual or group with regard to function or tasks at hand is called option A, morale. Option B, insubordination. Option C, initiative. Option D, tenacity. The correct answer is option A, morale. Explanation. Morale describes the confidence, enthusiasm, and emotional outlook of an individual or group toward its work and responsibilities. Question 30. A patient is having a seizure. Which of the following is the most appropriate step for the medical assistant to take to protect the patient? Option A, raise the patient's feet. Option B, call for help. Option C, loosen clothing around the patient's neck. Option D, administer small amounts of liquid. The correct answer is option C, loosen clothing around the patient's neck. Explanation. Loosening tight clothing around the neck can help protect breathing during a seizure. The patient should also be protected from injury and nothing should be placed in the mouth. Question 31. Name this part of the electrocardiogram. Option A, R2R interval. Option B, ST segment. Option C, PR segment. Option D, QRS complex. The correct answer is now shown. Explanation. The source does not include the referenced image or a keyed answer for this item, so the correct response cannot be supported from the supplied material alone. Question 32. When a person stays in the same position all the time, pressure causes the skin to option A, become firm and dry. Option B, weaken and become necrotic. Option C, become stronger. Option D, stay pink and moist. The correct answer is option B, weaken and become necrotic. Explanation. Prolonged pressure reduces blood flow to compressed tissue, which can cause tissue injury, breakdown, and eventually necrosis. Question 33. Which body system has the liver, gallbladder, and pancreas as accessory organs? Option A, digestive. Option B, endocrine. Option C, integumentary. Option D, lymphatic. The correct answer is option A, digestive. Explanation. The liver, gallbladder, and pancreas are accessory organs of digestion because they produce, store, or deliver substances that help digest food. Question 34. After a patient interview by the medical assistant, which of the following should not be recorded by the medical assistant? Option A, family medical history. Option B, examination narrative. Option C, chief complaint. Option D, medication allergies. The correct answer is option B, examination narrative. Explanation. The medical assistant may document information obtained during the interview, but the provider's examination narrative belongs to the provider's clinical examination and should not be independently created by the assistant. Question 35. A patient has a possible corneal abrasion and needs a referral. Which specialty is a physician that deals with eye injury and disease? Option A, ophthalmologist. Option B, oncologist. Option C, optician. Option D, optometrist. The correct answer is option A, ophthalmologist. Explanation. An ophthalmologist is a physician who diagnoses and treats eye diseases and injuries and can provide medical and surgical eye care. Question 36. The medical assistant was sent to the ward to draw blood for coagulation studies. Which of the following is correct about this draw? Option A. The medical assistant can use capillary tubes for the blood collection. Option B. Draw a red top tube before the light blue tube. Option C. Fill a light blue to the top. Option D. Before drawing the specimen, make sure the patient has fasted for 12 hours. The correct answer is option D. Before drawing the specimen, make sure the patient has fasted for 12 hours. Explanation. The source keys a 12-hour fast before coagulation studies, but fasting is not generally the defining requirement for routine coagulation collection. This item should be verified against the course source before use. Question 37. Choose the answer that corresponds with letter B. Option A, brachial artery. Option B, cephalic vein. Option C, ulnar artery. Option D, radial artery. The correct answer is now shown. Explanation. The source does not include the referenced image or a keyed answer for this item, so the correct response cannot be supported from the supplied material alone. Question 38. A patient weighs 83.92 kilograms. How many pounds does he weigh? Option A, 185 pounds. Option B, 210 pounds. Option C, 200 pounds. Option D, 195 pounds. The correct answer is option A, 185 pounds. Explanation. Using the common conversion of about 2.2 pounds per kilogram, 83.92 kilograms is approximately 185 pounds. Question 39. Which of the following is the most common means of transmitting pathogens? Option A, ingesting food. Option B, blood transfusions. Option C, coughing. Option D, touching. The correct answer is option D, touching. Explanation. Hands and touch are common ways pathogens move between people and surfaces, which is why hand hygiene is one of the most important infection prevention measures. Question 40. Insulin syringes are calibrated in Option A, milliliters. Option B, units. Option C, cubic centimeters. Option D, minims. The correct answer is option B, units. Explanation. Insulin syringes are marked in insulin units so the ordered dose can be measured according to the insulin concentration. Question 41. Which of the following statements is true under the doctrine of respondeat superior? Option A. The physician is responsible for any errors made by the medical staff. Option B. The person who has been employed for the longest period of time is responsible for any errors made by the medical staff. Option C. The medical administrative assistant is responsible for any errors made by the medical staff. Option D. The medical administrative assistant is superior to other members of the medical staff. The correct answer is now shown. Explanation. The source flashcard does not provide a keyed answer for this item. The answer and rationale should be confirmed from the original course material before the question is used. Question 42. The patient information sheet contains Option A. The past medical history of the patient. Option B. The patient's past family history. Option C. The patient's chief complaint. Option D. Patient's personal and insurance information. The correct answer is option D. Patient's personal and insurance information. Explanation. The patient information sheet is used to collect identifying, contact, and insurance information needed for registration, billing, and communication. Question 43. A female patient came into the emergency room with her husband. She was suffering from severe shortness of breath. She appeared to be unable to take in sufficient oxygen. What is the color of the skin and nail beds? Option A, brownish. Option B, greenish. Option C, reddish. Option D, bluish. The correct answer is option D, bluish. Explanation. Bluish discoloration of the skin or nail beds can indicate cyanosis, which occurs when the blood contains an increased amount of deoxygenated hemoglobin. Question 44. A 67-year-old man is diagnosed with atrial fibrillation and is treated with warfarin Coumadin. What is the characteristic of atrial fibrillation? Option A, sawtooth-shaped waves. Option B, P waves are absent. Option C, P waves with uniform shape. Option D, P waves of multiple shapes. The correct answer is option B, P waves are absent. Explanation. In atrial fibrillation, organized P waves are absent because atrial electrical activity is rapid and chaotic rather than produced by regular sinus node impulses. Question 45. Which of the following is not true regarding Health Insurance Portability and Accountability Act laws? Option A. Patients can make informed choices regarding how their personal health information is used. Option B. Few boundaries are set on the use and release of health records. Option C. Patients have more control over their medical records. Option D. Violators are held accountable if patient privacy rights are compromised. The correct answer is option B. Few boundaries are set on the use and release of health records. Explanation. The statement that few boundaries exist is false because the Health Insurance Portability and Accountability Act privacy rule places important limits on how protected health information may be used and disclosed. Question 46. Automaticity refers to: Option A, the ability of the myocardial cell to contract when stimulated by an electrical impulse. Option B, the ability to transmit an electrical stimulus from cell to cell throughout the myocardium. Option C, the ability to respond to an electrical stimulus. Option D, the ability of certain myocardial cells to produce an electrical impulse without the need for outside nerve stimulation. The correct answer is option D, the ability of certain myocardial cells to produce an electrical impulse without the need for outside nerve stimulation. Explanation. Automaticity is the ability of certain cardiac cells to generate electrical impulses spontaneously without an external nerve signal. Question 47. The interval between exposure to infection and the appearance of the first symptom is called: Option A, incubation period. Option B, active period. Option C, means of transmission period. Option D, incineration period. The correct answer is option A, incubation period. Explanation. The incubation period is the time between exposure to an infectious agent and the appearance of the first signs or symptoms of disease. Question 48. Your patient is experiencing chest pain and has a heart rate of 132 beats per minute. You attach the electrocardiogram monitor and see a fast, regular rhythm with a round upright P wave that precedes each QRS complex. The QRS complexes are 0.1 seconds in duration. This patient is experiencing: Option A, junctional escape rhythm. Option B, sinus tachycardia. Option C, complete atrioventricular heart block. Option D, idioventricular rhythm. The correct answer is option B, sinus tachycardia. Explanation. A fast regular rhythm with a normal upright P wave before every narrow Q or S complex is characteristic of sinus tachycardia because the rhythm is still originating from the sinus node. Question 49. What is the name of the heart valve that separates the right atrium and right ventricle and? Option A, aortic valve. Option B, tricuspid valve. Option C, pulmonic valve. Option D, mitral valve. The correct answer is option B, tricuspid valve. Explanation. The tricuspid valve lies between the right atrium and right ventricle and prevents backward flow into the atrium during ventricular contraction. Question 50. What is the correct way to calculate pulse pressure? Option A, the number found when subtracting the diastolic from the systolic. Option B, the sum of the diastolic and the systolic. Option C, the pulse taken at the carotid location. Option D, the pulse taken at the apical location. The correct answer is option A, the number found when subtracting the diastolic from the systolic. Explanation. Pulse pressure is calculated by subtracting the diastolic pressure from the systolic pressure, which shows the pressure difference between heart contraction and relaxation. Question 51. Which of the following is the best specimen to test for levels of iron in the blood? Option A, the one collected in a tube that contains sodium citrate. Option B, the one collected in a microcuvette. Option C, the one collected in the tube that contains ethylene tetrasic acid. Option D, the one collected in a tube with no additive. The correct answer is option C, the one collected in the tube that contains ethylene tetrasic acid. Explanation. The source keys the tube containing ethylene tetrasic acid. Because iron testing methods can depend on the laboratory protocol, this item should be checked against the specific course or laboratory standard being used. Question 52. Without a clot activator, whole blood typically clots in minutes. Option A, 60 to 20. Option B, 1 to 2. Option C, 30 to 60. Option D, 5 to 10. The correct answer is option C, 30 to 60. Explanation. Without a clot activator, blood in a plain collection tube may require about 30 to 60 minutes to clot completely before centrifugation. Question 53. A baby's pulse and respirations are: Option A, the same as adults. Option B, not significantly different than an adult. Option C, faster than an adult's. Option D, slower than an adult's. The correct answer is option C, faster than an adult's. Explanation. Infants normally have faster heart rates and respiratory rates than adults because of their smaller body size and higher metabolic demand. Question 54. What is the best location to check the pulse of an adult who is unconscious and not breathing? Option A, at the carotid artery of the neck. Option B, on the chest, directly over the heart. Option C, at the radial artery of the wrist. Option D, at the brachial artery of the arm. The correct answer is option A, at the carotid artery of the neck. Explanation. The carotid artery is a central pulse site that is commonly checked in an unresponsive adult because it can remain palpable when peripheral pulses are weak. Question 55. The acronym used to remember the actions to take when using a fire extinguisher is: Option A, ACT. Option B, HELP. Option C, Rescue, Alarm, Confine, and Extinguish or Evacuate. Option D, pull the pin, aim at the base, squeeze the handle, and sweep side to side. The correct answer is option D, pull the pin, aim at the base, squeeze the handle, and sweep side to side. Explanation. The fire extinguisher sequence is pull the pin, aim at the base of the fire, squeeze the handle, and sweep side to side so the extinguishing agent is directed effectively. Question 56. Somatic tremor is the result of: Option A, muscle movement. Option B, loose sensors. Option C, unequal amounts of electrolytes. Option D, improper standardization of the instrument. The correct answer is option A, muscle movement. Explanation. Somatic tremor is an electrocardiogram artifact caused by skeletal muscle movement, such as shivering, tension, or patient motion during the recording. Question 57. Which mode of infection transmission occurs from touching contaminated linens? Option A, droplet contact. Option B, direct contact. Option C, vehicle contact. Option D, indirect contact. The correct answer is option D, indirect contact. Explanation. Contaminated linens act as an intermediate object, so transmission from touching them is classified as indirect contact rather than direct person-to-person contact. Question 58. What drug prevents the action of another drug or chemical? Option A, trade. Option B, narcotic. Option C, synergist. Option D, antagonist. The correct answer is option D, antagonist. Explanation. An antagonist blocks or reduces the action of another drug or chemical by opposing its effect at a receptor or through another mechanism. Question 59. The term refers to the list of charges for each of the provider's services. Option A, fee schedule. Option B, coinsurance. Option C, copayment. Option D, cost sheet. The correct answer is now shown. Explanation. The source flashcard does not provide a keyed answer for this item. The answer and rationale should be confirmed from the original course material before the question is used. Question 60. The smallest structural unit of the nervous system is the: Option A, spinal cord. Option B, neurofibrils. Option C, neuron. Option D, supine. The correct answer is option C, neuron. Explanation. The neuron is the basic structural and functional cell of the nervous system because it receives, processes, and transmits nerve signals. Question 61. A patient came into the doctor's office with chest pain and shortness of breath. Which position is the best to help him breathe better? Option A, lithotomy. Option B, prone. Option C, Fowler's. Option D, supine. The correct answer is option C, Fowler's. Explanation. Fowler's position raises the head and upper body, which can improve chest expansion and make breathing easier for a patient with shortness of breath. Question 62. Postprandial means: Option A, before a meal. Option B, before bedtime. Option C, fasting. Option D, after a meal. The correct answer is option D, after a meal. Explanation. Postprandial means after a meal, so a postprandial measurement or instruction is timed after eating. Question 63. Identify the following rhythm. Option A, atrial fibrillation. Option B, ventricular fibrillation. Option C, junctional tachycardia. Option D, asystole. The correct answer is now shown. Explanation. The source does not include the referenced image or a keyed answer for this item, so the correct response cannot be supported from the supplied material alone. Question 64. What is the minimum number of electrodes that may be attached to the patient for Holter monitoring? Option A, 12 electrodes. Option B, 2 electrodes. Option C, 5 electrodes. Option D, 10 electrodes. The correct answer is option C, 5 electrodes. Explanation. The source specifies 5 electrodes as the minimum for this Holter monitoring setup. The exact lead configuration can vary by device, so equipment instructions should be followed. Question 65. What is the name of the law that protects healthcare workers who gave aid during the time of an accident? Option A, Good Samaritan Law. Option B, Megan's Law. Option C, Right to Know Law. Option D, Health Insurance Portability and Accountability Act. The correct answer is option A, Good Samaritan Law. Explanation. Good Samaritan laws are intended to provide certain legal protections to people who voluntarily give emergency assistance in good faith, although the exact protections vary by jurisdiction. Question 66. A collection tube containing an anticoagulant must be inverted how many times? Option A, tubes containing anticoagulants are not inverted at all. Option B, 10 times. Option C, 8 times. Option D, shake vigorously for 30 seconds. The correct answer is option C, 8 times. Explanation. Anticoagulant tubes are gently inverted several times so blood mixes evenly with the additive and small clots do not form. The source specifies 8 inversions for this item. Question 67. Which of the following tests is not a part of complete blood count? Option A, activated partial thromboplastin time. Option B, differential. Option C, hemoglobin. Option D, hematocrit. The correct answer is option A, activated partial thromboplastin time. Explanation. Activated partial thromboplastin time is a coagulation test, not a component of the complete blood count, which evaluates blood cells and related indices. Question 68. Before developing a medication schedule, you should evaluate the patient's Option A, bathroom habits. Option B, medical record. Option C, daily routine. Option D, side effects. The correct answer is option C, daily routine. Explanation. A medication schedule is more likely to be followed when it fits the patient's normal daily routine, such as waking, meals, work, and bedtime. Question 69. Which of the following is classified as abnormally rapid, deep, or labored breathing? Option A, hypertension. Option B, tachypnea. Option C, hypernia. Option D, hyperpyrexia. The correct answer is option B, tachypnea. Explanation. The source keys tachypnea. Tachypnea specifically means abnormally rapid breathing, while deep or labored breathing may be described with other respiratory terms, so the wording should be reviewed. Question 70. One example of a physiologic response to negative stress is Option A, headache. Option B, high energy. Option C, sleep deprivation. Option D, upset stomach. The correct answer is now shown. Explanation. The source flashcard does not provide a keyed answer for this item. The answer and rationale should be confirmed from the original course material before the question is used. Question 71. Choose the answer that corresponds with letter F. Option A, basilic vein. Option B, medicancubital vein. Option C, radial artery. Option D, cephalic vein. The correct answer is now shown. Explanation. The source does not include the referenced image or a keyed answer for this item, so the correct response cannot be supported from the supplied material alone. Question 72. The act of listening for sounds made by internal organs to aid in the diagnosis of certain disorders is called Option A, menstruation. Option B, percussion. Option C, auscultation. Option D, palpation. The correct answer is option C, auscultation. Explanation. Auscultation means listening to internal body sounds, usually with a stethoscope, such as heart, lung, and bowel sounds. Question 73. Normal sinus rhythm has a heart rate of beats per minute. Option A, 80 to 120. Option B, 50 to 75. Option C, 60 to 100. Option D, 40 to 60. The correct answer is option C, 60 to 100. Explanation. Normal sinus rhythm is commonly defined as a regular sinus rhythm with a rate from 60 to 100 beats per minute in an adult. Question 74. The medical assistant is to collect a prothrombin time test, a complete blood count, and a fasting blood sugar. What is the correct order of draw? Option A, gray fasting blood sugar, lavender prothrombin time, red complete blood count. Option B, light blue prothrombin time, lavender complete blood count, gray fasting blood sugar. Option C, lavender fasting blood sugar, red complete blood count, green prothrombin time. Option D, gray fasting blood sugar, lavender complete blood count, light blue prothrombin time. The correct answer is option B, light blue prothrombin time, lavender complete blood count, gray fasting blood sugar. Explanation. The keyed order places the light blue coagulation tube before the lavender hematology tube and the gray glucose tube, which follows the source's order of draw sequence for these specimens. Question 75. Which of the following are also referred to as serum separator tubes? Serum separator tube. Option A, red and gray top tubes. Option B, red top tubes. Option C, light blue top tubes. Option D, lavender top tubes. The correct answer is option A, red and gray top tubes. Explanation. Red and gray marbled tubes are serum separator tubes because they contain a gel barrier that separates serum from blood cells after centrifugation. Question 76. A murmur is an abnormal sound that may indicate: option A, intestinal obstruction. Option B, valvular heart disease. Option C, stroke. Option D, bronchial asthma. The correct answer is option B, valvular heart disease. Explanation. A heart murmur is an extra or unusual sound caused by turbulent blood flow and may be associated with abnormal heart valves. Question 77. The correct lead from the center of heart to the positive pole of the leg is: option A, augmented voltage foot lead. Option B, augmented voltage right arm lead. Option C, lead 3. Option D, lead 2. The correct answer is option A, augmented voltage foot lead. Explanation. The augmented voltage foot lead views electrical activity toward the positive electrode on the left leg from a calculated central reference point. Question 78. After obtaining an electrocardiogram tracing, a medical assistant would be expected to: option A, check the patient with a pulse oximeter to verify accuracy of the electrocardiogram tracing. Option B, evaluate the patient's medication list for cardiac-altering drugs. Option C, instruct the patient on the tracing results and cardiac prognosis. Option D, observe the tracing for quality and decide if another tracing may be required. The correct answer is option D, observe the tracing for quality and decide if another tracing may be required. Explanation. After recording an electrocardiogram, the medical assistant should check the tracing for artifact and technical quality and repeat it when necessary rather than interpret the diagnosis for the patient. Question 79. Cellular respiration is a function of the: option A, cell membrane. Option B, mitochondria. Option C, Golgi apparatus. Option D, nucleus. The correct answer is option B, mitochondria. Explanation. Mitochondria generate most cellular energy through aerobic cellular respiration, which is why they are often called the energy-producing structures of the cell. Question 80. Managed care organizations control costs by: option A, limiting patient enrollment. Option B, detecting risk factors early. Option C, discouraging patient visits. Option D, eliminating case managers. The correct answer is now shown. Explanation. The source flashcard does not provide a keyed answer for this item. The answer and rationale should be confirmed from the original course material before the question is used. Question 81. A monitor that a patient wears for 24 hours is called an: option A, Holter. Option B, 12 lead. Option C, Holter. Option D, echocardiogram. The correct answer is option C, Holter. Explanation. A Holter monitor records the heart's electrical activity continuously during normal daily activities, commonly for about 24 hours or longer. Question 82. Which situation would a medical assistant's signature be required? Option A, after the chief complaint is documented. Option B, after the patient gives a medical history account. Option C, on an informed consent document. Option D, when a patient gives implied consent. The correct answer is option C, on an informed consent document. Explanation. An informed consent document requires signatures to show that the consent process was completed and documented according to office policy and legal requirements. Question 83. Which of the following cannot be handled by the medical assistant? Option A, patient requesting emergency medical advice. Option B, new patient and return appointments. Option C, directions to the facility. Option D, whether or not a physician is in a certain health plan. The correct answer is option A, patient requesting emergency medical advice. Explanation. A request for emergency medical advice requires clinical assessment and decision-making beyond routine administrative handling by a medical assistant and should be escalated according to office protocol. Question 84. A routine hand wash procedure uses plain soap to remove soil and transient bacteria. Option A, scrub brushes. Option B, antimicrobial soap. Option C, gel-based creams after the routine hand wash. Option D, medicated towels for drying clean hands. The correct answer is option B, antimicrobial soap. Explanation. The source keys antimicrobial soap, but the stem states that routine handwashing uses plain soap. This item is internally inconsistent and should be reviewed against the original course material before use. Question 85. Demerol 75 mg, intramuscular every 4 hours, as needed for severe pain, is what type of medication order? Option A, single. Option B, as needed. Option C, immediate. Option D, routine. The correct answer is option B, as needed. Explanation. The phrase as needed means the medication is given only when the patient meets the stated need, so this is an as needed medication order rather than a routine or one-time order. Question 86. What is the process used to wash and remove blood and tissue from medical instruments called? Option A, asepsis. Option B, sanitization. Option C, disinfection. Option D, sterilization. The correct answer is option B, sanitization. Explanation. Sanitization is the cleaning step that removes visible soil, blood, and tissue from instruments before higher-level disinfection or sterilization when required. Question 87. The patient has been given a prescription that says the medication should be taken twice daily. This medication should be taken, option A, before bedtime. Option B, once a day. Option C, before meals. Option D, twice a day. The correct answer is option D, twice a day. Explanation. Twice daily means the medication is taken 2 times during the day at the intervals directed by the prescriber. Question 88. A round, raised skin lesion with itching that is a positive sign of reaction to allergic testing is A. Option A, wheal. Option B, nodule. Option C, papule. Option D, vesicle. The correct answer is option C, papule. Explanation. The source keys papule, but allergy skin testing is commonly described as positive when a wheal develops. This item should be reviewed because the supplied key and standard terminology may not agree. Question 89. A blood sample is collected from a patient and the plasma is pink to red in color. Which of the following is the most likely cause? Option A, polycythemia. Option B, hemolysis. Option C, lipema. Option D, agglutination. The correct answer is option B, hemolysis. Explanation. Hemolysis releases hemoglobin from ruptured red blood cells, which can make serum or plasma appear pink to red. Question 90. If a finger is excessively milked during a skin puncture, the result will be: Option A, a decrease in pain for the patient. Option B, increased venous blood flow to the puncture site. Option C, an adequate of blood for filling several capillary tubes. Option D, hemolysis and contamination of the specimen with tissue fluids. The correct answer is option D, hemolysis and contamination of the specimen with tissue fluids. Explanation. Excessive squeezing of a puncture site can damage blood cells and mix tissue fluid with the sample, causing hemolysis and dilution or contamination of the specimen. Question 91. What is the best sample for the determination of blood pH and blood gases? Option A, cerebrospinal fluid. Option B, arterial blood. Option C, venous blood. Option D, capillary blood. The correct answer is option B, arterial blood. Explanation. Arterial blood is preferred for blood gas testing because it best reflects oxygenation, ventilation, and acid-base status after gas exchange in the lungs. Question 92. Which of the following precautions require special air handling and ventilation? Option A, contact precautions. Option B, standard precautions. Option C, airborne precautions. Option D, droplet precautions. The correct answer is option C, airborne precautions. Explanation. Airborne precautions require special ventilation because very small infectious particles can remain suspended in the air and travel beyond the immediate patient area. Question 93. A structure that is composed of 2 or more tissue types is called an. Option A, system. Option B, organism. Option C, organ. Option D, cell. The correct answer is option C, organ. Explanation. An organ is made of two or more tissue types that work together to perform specific functions. Question 94. Most specialists are paid by managed care organizations using which of the following methods? Option A, fee-for-service. Option B, coinsurance. Option C, copayment. Option D, capitation. The correct answer is option A, fee-for-service. Explanation. Fee-for-service reimburses the specialist for individual services performed rather than paying a fixed amount per enrolled patient. Question 95. An obese patient was sent to the laboratory for a complete blood count. Which of the following veins is MOT likely to be the only that the phlebotomist can palpate? Option A, basilic vein. Option B, cephalic vein. Option C, median cubital vein. Option D, sclerosed vein. The correct answer is option B, cephalic vein. Explanation. The cephalic vein lies along the outer side of the arm and may be easier to palpate in some patients when deeper veins are difficult to locate. Question 96. Complete destruction of all forms of microbial life. Option A, sterilization. Option B, germicide. Option C, sanitization. Option D, disinfection. The correct answer is option A, sterilization. Explanation. Sterilization destroys all forms of microbial life, including bacterial spores, which distinguishes it from cleaning and most disinfection processes. Question 97. Which of the patient's limb serves as an electrical ground? Option A, right arm. Option B, left leg. Option C, left arm. Option D, right leg. The correct answer is option D, right leg. Explanation. In a standard electrocardiogram setup, the right leg electrode serves as the reference or ground electrode and is not used to form the main diagnostic limb leads. Question 98. You performing a venipuncture procedure on a patient. The needle appears to be inside the vein yet no blood ID flowing into the tube. What should you do? Option A, pull back on the needle. Option B, terminate the procedure. Option C, slightly rotate the needle. Option D, switch the tubes. The correct answer is option D, switch the tubes. Explanation. If the needle appears to be in the vein but no blood enters the tube, a defective tube with lost vacuum is one possible cause, so changing the tube is an appropriate troubleshooting step. Question 99. Which of the following skills would not be an appropriate expectation of the competent medical assistant? Option A, giving instructions to patients about self-care after treatments. Option B, diagnosing common patient symptoms. Option C, performing insurance coding and billing. Option D, using the computer to perform a variety of office functions. The correct answer is option B, diagnosing common patient symptoms. Explanation. Diagnosing symptoms is a provider-level clinical responsibility and is not an appropriate independent duty for a medical assistant. Question 100. Another term for outpatient care is: Option A, rehabilitation care. Option B, non-ambulatory care. Option C, ambulatory care. Option D, nursing home care. The correct answer is option C, ambulatory care. Explanation. Ambulatory care means healthcare provided without an overnight hospital admission, so it is another term for outpatient care. Question 101. Mr. Smith is suffering from an enlargement of the bones in the entire skull as well as in the hands and feet, in addition to thickening of the skin. Which of the following conditions is Mr. Smith suffering from? Option A, Addison's. Option B, Cushing's. Option C, acromegaly. Option D, cretinism. The correct answer is option C, acromegaly. Explanation. Acromegaly results from excess growth hormone after the growth plates have closed, producing enlargement of the hands, feet, facial bones, and soft tissues. Question 102. A female patient came into the office for her scheduled routine physical. You are measuring the patient's vital signs. Which part of the brain is responsible for the temperature regulation? Option A, hypothalamus. Option B, thalamus. Option C, medulla oblongata. Option D, pons. The correct answer is option A, hypothalamus. Explanation. The hypothalamus helps regulate body temperature by comparing internal temperature signals with the body's set point and triggering heat loss or heat conservation responses. Question 103. The four symptoms of inflammation are erythema, edema, pain, and Option A, irritation. Option B, vomiting. Option C, heat. Option D, headache. The correct answer is option C, heat. Explanation. The classic local signs of inflammation include redness, swelling, pain, and heat caused by increased blood flow and inflammatory activity in the affected area. Question 104. Which of the following blood pressure readings would be considered stage 1 hypertension? Option A, 148/96. Option B, 116/72. Option C, 126/84. Option D, 178/104. The correct answer is option A, 148/96. Explanation. The source classifies 148/96 as stage 1 hypertension. Blood pressure categories can vary by guideline and era, so use the classification system required by the course. Question 105. During assessment, the best source from which to obtain patient information is the option A, the medical record. Option B, physician's notes. Option C, a family member. Option D, the physician. The correct answer is option A, the medical record. Explanation. The medical record is the organized source of documented patient information, including history, medications, allergies, prior findings, and treatment information. Question 106. The normal volume of urine produced by an adult in a 24-hour period generally does not exceed option A, 2,000 liters. Option B, 2,000 milliliters. Option C, 400 milliliters. Option D, 750 milliliters. The correct answer is option B, 2,000 milliliters. Explanation. The source uses about 2,000 milliliters as the upper end of typical daily adult urine output, although normal output varies with intake and clinical condition. Question 107. Which of the following drug administration routes is the most appropriate for a patient who has nausea and vomiting? Option A, nasal. Option B, buccal. Option C, sublingual. Option D, rectal. The correct answer is option D, rectal. Explanation. The rectal route can be useful when nausea and vomiting make swallowing or retaining an oral medication difficult. Question 108. While Mr. Dillon's hematocrit is spinning in the centrifuge, you perform an automated hemoglobin test on a sample of his blood and record the value as 15 grams per deciliter. You do a quick mental calculation and expect that the hematocrit value will be approximately option A, 5 grams per deciliter, option B, 5%, option C, 45%, option D, 45 grams per deciliter. The correct answer is option C, 45%. Explanation. A common screening estimate is that hematocrit is about 3 times the hemoglobin value, so a hemoglobin of 15 grams per deciliter suggests a hematocrit near 45%. Question 109. The physician prescribes a buccal medication. The medical assistant should instruct the patient to option A, place the medication between the lower teeth and cheek. Option B, chew the medication and swallow it. Option C, place the medication under the tongue. Option D, dissolve the medication in water and drink it. The correct answer is option A, place the medication between the lower teeth and cheek. Explanation. A buccal medication is designed to dissolve between the cheek and gum so the drug can be absorbed through the lining of the mouth. Question 110. The functional unit of the kidney is the option A, nephron. Option B, ureter. Option C, urethra. Option D, bladder. The correct answer is option A, nephron. Explanation. The nephron is the microscopic functional unit of the kidney that filters blood and helps form urine. Question 111. Which of the following should be used to chill a specimen as it transported? Option A, a small freezer unit. Option B, frozen blocks of ice. Option C, crushed ice. Option D, tepid water. The correct answer is option C, crushed ice. Explanation. Crushed ice surrounds the specimen closely and provides efficient chilling when a test requires transport at a low temperature. Question 112. The phenylketonuria test is used to diagnose deficiency of phenylalanine hydroxylase, the most common clinically encountered inborn error of metabolism. It is performed on option A, blood drawn from a newborn's finger. Option B, a newborn's fecal specimen. Option C, blood drawn from a newborn's buttocks. Option D, blood drawn from a newborn's heel. The correct answer is option D, blood drawn from a newborn's heel. Explanation. Newborn screening for phenylketonuria is commonly performed on capillary blood collected by heel puncture and applied to the designated screening medium.